Hello, I'm Dr. Anthony Talorico. I'm going to talk today about inflammation, and the topic of this talk is "You inflamed, bro." So there's this little thing that people used to say all the time, that when to irritate somebody they'd say, "You mad, bro?" Well, you inflamed, bro? Let's find out. Are you fat, tired, and hungry all the time? Do your joints hurt? Are you moody? Do you have high blood pressure, heart disease, diabetes, or any of these other autoimmune type diseases? You might be inflamed. So let's talk about the reason why. The number one reason why people develop systemic inflammation is their diet. And so the inflammation process is basically a way that your body knows that there's trauma or injury going on. And inflammation is actually necessary to heal. But chronic inflammation is a disease process that really has tentacles into every other disease process. So the main diseases of mankind, of all the Neolithic diseases of mankind, are inflammation-backed diseases, and they kill lots and lots of people because the fundamentals of what the human body needs in terms of nutrition and things isn't there. So a lot of us are inflamed. They walk around every day with constant inflammation, and they get by with taking pain relievers or medication. I have a patient, he was taking 2,400 milligrams of ibuprofen every day for years just because he had so much joint pain. And and although you would ask him and he would seem like a very healthy, happy, cheerful guy, he really wasn't. He was doing the best of what he knew how to do. And so through a metabolic program that we put him on, he lost 50 pounds. And he also stopped needing to take ibuprofen. He went from taking 2,400 milligrams of ibuprofen a day to none, because his body was in such an inflamed state due to the diet that he had adapted. And you know the diet. You're probably eating it. Chances are most people are eating it. That's why we have 86 million pre-diabetics, because we're eating lots and lots of things that are very inflammatory. They're mostly starches and carbohydrates, and those weren't things that the human body is really developed to eat in large quantities. So if we look at our evolutionary standpoint, we were hunter-gatherers, so we didn't always have tons of things to eat all the time. So we adapted very well to infrequent meals, and we adapted very well to things like meats and fats, proteins and fats. And most of the carbohydrates and sugars that we got were from berries and fruits, which are actually very beneficial because they have lots of nutrients. So eating a cereal grain or a starch in a lot of quantity is an inflammatory thing that happens to the body. So the standard American diet is, you eat cereal for breakfast, you have a sandwich for lunch, and you have a dinner with some type of starch and a meat, and you've eaten most of your calories in forms of starches and sugars, and that's an inflammatory process in and of itself. Now there are better ones to take, and there's definitely some varying theories on this, but if you look at a person over time and their body is developing insulin resistance, or they're just in a lot of pain all the time, they have lots of joint pain, they don't know why, they don't sleep well, they're grouchy, they're probably in an inflammation-based state, and we need to make changes in order to stop some of these other more serious things from developing. We know right now that the heart disease is really an inflammatory disease. It has very little to do with cholesterol. I know cholesterol is a hot button, and people talk about cholesterol all the time. My cholesterol's high, my cholesterol's low, my good cholesterol, my bad cholesterol. Really, that is a gross misunderstanding of an issue that is more complex. The main factor in heart disease is inflammation. So when the body is very inflamed, the signals of trauma and inflammation are being given off by the vessels. The body comes in to try to heal that. There causes some plaquing and some clogging of the artery, and that process is one because inflammation is rampant. The main reason that the blood vessel in the heart and the vessels that are the most highly oxygenated vessels that carry the most oxygen-rich blood from the lungs into the body get inflamed is because they have so much oxygen. They require a lot of antioxidants. So an anti-inflammatory diet eating anti-inflammatory also tends to be one that is high in antioxidants. So antioxidants are anti-inflammatory, and so they help to really control and mitigate anything that might be going on there. So heart disease exploding the way it is has a lot to do with just a general state of inflammation. And the same thing happens with, blood pressure. A lot of people think, well, blood pressure is just something that happens, everybody in my family has it, it's genetic, blah, blah, blah. Maybe there's something to be said about that, but I bet you also do the same things that your family did. You eat the same diet they ate, you do things the same way, your activity levels are similar. You might not have exactly the same genetics, but in my family, some people had hypertension, some people don't. But I have to think it's something to do with lifestyle as well. So we can blame a lot of things on genetics, but genes just basically encode for proteins. So a gene's just going to say your body to make this protein or that protein, and you can influence that gene by what you do. That's called epigenetics. And epigenetics is super important because just having a bad gene is like a bullet in the chamber, but doing the wrong behaviors fires the gun, it pulls the trigger. Epigenetically, you can prevent that from happening by changing your behaviors. This has been shown, this is scientifically proven. So inflammation is a major problem, it's a major disease state, and it's a disease in and of itself, but it's a byproduct of all the other diseases. So you inflamed is basically saying, hey, we've got this problem, our body isn't working the way it's supposed to work, we don't feel well, we're cranky, moody, we have blood pressure medication we have to take, we might be developing diabetes, and chances are we're going to have heart disease, we're going to have dyslipidemia, and the whole thing goes back to, are you inflamed? So think about that. Think about what decisions you can make. And remember, inflammation isn't bad. It's the chronic inflammation that's bad. So if I go and I sprain my ankle falling down steps or whatever, which I've done, you get this swelling and you get this inflammation. That inflammation brings in part of the immune system called macrophages. Macrophages come in and they gobble up the dead, damaged, diseased tissue and also deposit local growth factors. So the inflammation, the first part of inflammation is getting the immune system online and helping the body to heal the problem. If you never got inflamed, you wouldn't heal. If I go and exercise, like I go and work out, I create inflammation in my muscle, but that muscle damage tells my body, hey, we have to come in and mobilize and we have to fix this. There's inflammation, there's some discomfort, but then there's the repair and the remodeling phase. And so by doing an exercise that may cause inflammation, I'm actually setting the stage for my body to actually adjust to that and create more strength, more stability, more everything, because we've remodeled over and above what the damage was. So inflammation in and of itself is not a bad thing. It's part of the elaborate process that's evolved in human beings over millions of years, and it's a great survival adaptation. Inflammation allows you to live, but when you have too much of it and it's going all the time, it's a disease state. So it's a fine line. It's a two-edged sword. It's good and it's bad. We have to keep it at its minimum unless they have a trauma or an injury. And that kind of goes into what do you do after an injury. A lot of people want to take, anti-inflammatory medication. I don't recommend that. I don't recommend that you ice for protracted lengths of time either. I recommend that you begin to move as early as possible. Not necessarily full weight bearing, but you have some motion, maybe just contracting the muscles a little bit, and that you can put pressure on it to help some of the swelling and inflammation go back. But just icing it is just for pain. It actually it slows down the repair process, as does taking things like ibuprofen or aspirin or Tylenol. Those things are people take them because of the pain, but the actual benefit is to let the body go through its healing process that's evolved over a very long period of time.